Hi, this is Dr. David Zahaluk, and we're wrapping up the third of our three-part video series. This is Mia Bevers. She's our in-house resident billing specialist, and we're talking about things that you can do to control your healthcare costs while using your health insurance and still get great care. So, Mia, what we're going to focus on with this video is things that people can actually do, kind of like a checklist of what patients can do to help to control their costs and spend their money wisely. So, what do you got for us?
The first thing would be to check and see if you have an FSH, which is a flexible spending account, or an HSA, which is your health spending account. And if so, to use those because, one, they are done prior to taxes taken out, and they're either self-funded or employer-funded. And a lot of times that amount of money will not roll over the next year. So if you don't use it, then you lose it, kind of thing.
Right.
So you want to check and see if you have that. If you do, then you might want to check and see if your physician will keep that card or that information on file for you. That way, if you don't have it, you don't run a risk of paying out of pocket and then not getting reimbursed and the year passing by.
That's the worst, because sometimes people have money set aside, either that their employer set aside for them or that they took out of their paycheck, and then they use other money, and if that set aside money goes away, then they're stuck.
Right.
Okay. And what else?
And then also, again, knowing your deductibles and your co-insurances and your co-pays. That way you are not shocked when you come in the office and you're prepared for whatever the cost may be.
Okay. And is it good for patients to ask to keep can they keep the HSA or FSA card on file at the doctor's office?
In our office, we do that for our patients, which helps them a lot. And some other offices might as well. You just need to check with your physician and see if that's something they offer.
Kind of case by case. Okay.
Right.
What else?
Also, if you know or if you plan on having a high cost procedure or exam done, then go ahead and ask and see if they offer payment plans, because the office would prefer for you to have a payment plan and get the service that you need instead of not having it at all and then having complications later on.
Yeah, it's always less expensive to get it handled the right way at the beginning than try and wait and then see what develops. So yeah, that sounds good. I've got a couple of other things I want to jump in with. In terms of prescriptions, it's good to talk to your doctor about which of your prescriptions are suitable for generic and which ones need brand name only. If a drug has a very, what they call, narrow therapeutic to toxic window, meaning if it's just a little bit of a higher dose, it goes from being effective to hurting you, obviously you can't use a generic in that situation. That's drugs like chemotherapy, some cardiovascular drugs and stuff. But for a lot of people and a lot of medications, using a generic is a good, safe alternative. You just have to talk to your doctor about that. And I'd also investigate to see if you can do a mail order plan for your pharmacy. Usually the cost is going to be a third to a half less than getting the same prescription filled at a local drugstore, and you get 3 months at a time. Not all plans have that available, and the formulary or the available list of drugs may be different for mail order, but it's still a good thing to investigate. And make sure you're working with a pharmacy that you know and trust, and that they understand your insurance. I know they have a lot of work. People at the pharmacy process a lot of claims, and they fill a lot of drugs, but you still have to have a good working relationship with them. I think we talked about getting a physical. It does help to control your healthcare costs because we find things when they're easier to treat and therefore less expensive, but also, more importantly, better for your health. And the last thing I'll mention would be using urgent care instead of the ER. It's proven that it's way more expensive to go to the ER than an urgent care if it's something that an urgent care can handle. If you think you're having a heart attack, don't go to urgent care, go to ER. But if you got something that needs to be seen today, but maybe it doesn't need a level of ER care, it's much more cost effective to go to the urgent care. In our practice, we function as an urgent care and a primary care. And often when someone comes in with something that's more of an acute, serious situation, if they need to be admitted, we'll admit them directly rather than sending them to the ER for admission. That's in most cases. And so again, we can keep those costs down, and it's just better care anyway because there's a direct handoff. So those are some of the things that I think people can do to control their healthcare costs. And Mia, if somebody has a more specific question, we try to cover a lot of things here, but if somebody has a more specific question, is it okay for them to call and ask and see if we can give them some clarification?
Yes, please do. Just give our office a call at 972-221-3500, and we'll be happy to try to help you as best as we can.
Terrific. Thanks. I hope that was helpful.